Hey, here are 6 tips that I think are going to help you as a mental health nurse. Tip number 1 is this. When you get on your unit, just grab a handful of gloves and shove them in your pocket. I can't tell you how many times I've been either in the day hall doing wellness, checking in on patients, whatever, and I'm like, man, I wish I had some gloves right now. And it probably took me like 3 times, like 3 kind of bigger times when I'm like, okay, I'm not going to forget this. Now it's habit. Every time I walk into work, the first thing I do is I just grab a handful of whatever we use, nitrile gloves or whatever, shove them in my pocket, and I'm good to go. You want enough gloves for yourself, and then maybe you have to yell help. People show up and they're like, oh, we wish we had gloves too. And you're like, look, I got gloves in my pocket. So you don't want to be doing wellness. You open up the door, a patient's like vomiting, seizing, bleeding, whatever, and not have gloves. Trust me. My second tip is to make sure you know the indication for the medication you're going to administer. With psych patients especially, if you go to give them a med and they're like, what's this for? You tell them, I don't know, or you have no idea, they might get pissed. So it's simply best practice, probably just as a nurse in general, to know when you're giving a med what the medication is for. And if for whatever reason you just happen to give a medication, you have no idea what it's for, and the patient's like, what is this medication for? Instead of saying, I don't know, just say, let me look it up. My third tip is when you're giving pain medication to someone who takes it chronically, like 2 or 3 times a day, Tylenol, ibuprofen, whatever, instead of saying, hey, what's your pain out of 10? Because for whatever reason, these people probably been asked it like a billion times, so they're sick of hearing it. Just say, what do you want me to put down as your pain score? And they'll just say, put me down for like a 4 or 5. Trust me, I had some patients on this particular unit, when I asked them their pain score, they just hated it. And I was like, I gotta come up with a different way to phrase it. So instead I just said, hey, what do you want me to throw down as your pain score? The computer wants to know, whatever. You just throw it down. It's much simpler. Nobody gets pissed off. My fourth tip is when you're floating to a new unit or you arrive on a unit, you don't know any of the patients, take the time during morning report to learn the patient names. Take your face sheet, look at their face, and come up with some sort of mnemonic for that patient. You do this to show basic respect for the patient. When someone comes in and they're brand new and they know your name, just imagine if you're a patient and they didn't know your name. I mean, it's kind of a big deal, right? I feel like names are kind of a big deal, so know their name. And then not only that, if you have to communicate about a particular patient, you don't want to have to try to give a physical description. It's much easier just to know their name. We've made it this far. If you like the video, please, give it a thumbs up, subscribe, share it with somebody, leave a comment, leave a quirky question, or just say something embarrassing. All right, my fifth tip is this. When you go to interact with a patient, you go to do something with them, just assume that whatever you go to do, they want it. So if I go out and I go to take a patient's vitals, I'm not going to be like, hey, do you want your vitals taken? Because people just like to say no. It's easy to refuse, right? Just go up and say, hey, my name's Bob. Or I would just be like, yo, Bob. No, I wouldn't say yo. Depends on who the patient is. I might actually say yo. Sometimes I say yo. Hi, Mary. My name's Nick. I'm the nurse on the unit today. I'm going to take your vitals. Or, hi, Bob. My name's Nick. I'm the nurse on the unit today. Here's your Zyprexa. I'm not going to say, do you want me to take your vitals? Do you want your Zyprexa? You just don't want to give people, it's like sales. You just kind of tell them what to do. Back in the day when I used to work at this bookstore and we try to get these people to sign up for this free rewards card, right? We'd spam them with emails, they get these little coupons, etc. If I was like, hey, we have this rewards card, do you want to just put your email down there and then you'll get free stuff in your email? Most people would just be like, no, I don't want that crap. But it was like, hey, we got this free card, it's going to save you money, just throw your email down there. Boom. It was like 80%. I'd have like 80% of people sign up. Same thing goes with psych patients. Just say, hey, I'm here to take your vitals. Do you want me to take the blood pressure on your left or your right arm? All right, my sixth and final tip is when you want a patient to do something or to not do something, when you don't want a patient to do something, phrase it positively. Like for instance, let's say you got a patient who's pacing in the day hall very frequently because of the medication, because of restlessness, because of their diagnosis, whatever. Let's say they're pacing in a busy day hall and it just seems a little dangerous to you. You got patients walking too close together. You go up to this patient and you're like, Antoine, do me a favor, pace either in the hallway or pace in the room. Thank you. That's it. You don't say don't pace in the day hall. Just say pace and give them options. Just always give them options. Say pace here and here. What I like about this, it works with everybody, not just psych patients. Try this on your loved ones, your family, your friends, etc. Is that it just keeps things positive. It doesn't sound negative at all. You don't sound like a parental figure telling them what to do and what they can or can't do. You're just saying, hey, please pace either in the day. Please pace either in your room or in the hallway. That's it. All right. So those are our 6 tips. Our first tip was to grab a pair of gloves, a bunch of gloves when we arrive to work. Our second tip was to know the indication for the medication that we're going to administer. Our third tip was when giving a chronic pain med, we just say, hey, what number do you want me to put down for your pain score? Our fourth tip was learn the names and faces of the patients you're going to be working with as soon as possible. Our fifth tip was we're just going to assume they want something. Hey, Bob, I'm here to take your vitals. And our sixth tip was to phrase things positively. Pace in the hall or in your room, please. All right, I hope you enjoyed this video. And stay tuned for my next video. It'll be out in probably like another 3 months, 6 months, probably like a year or something. We'll see. All right. Thank you so much. Bye-bye.